This conference will now be recorded.
Hi everyone, my name is Shuster, and I'm going to be presenting today on our poster, which is entitled Perinatal Periods of Risk, Using Data and Community Voice to Address Infant Mortality. And I am from the Department of Public Health, Maternal Child Family Health Division in Philadelphia, and my role there is the Community Coalition Manager. So before I go into our poster, I just want to share a little bit about the program that is utilizing the Perinatal Periods of Risk. That program is called the Community Action Network, and I can zoom in a little bit on this poster on the logo, which is down here. You can see Together We Can, Philadelphia. The Community Action Network is a collective impact-based coalition in Philadelphia that works to reduce infant mortality. And it is made up of partners throughout Philadelphia that work in infant and maternal health with the overall goal, again, of reducing infant mortality and reducing the disparities. And the Department of Public Health, as well as Maternity Care Coalition and Einstein Health Network, are the backbone of this group. And so everything we talk about during this poster presentation is happening through this awesome coalition called the CAN. And you can learn more about the CAN at phillycan.com. Now I'm going to talk a little bit about the poster and about the perinatal periods of risk. I'm going to zoom out so we can see the whole poster, and I'll zoom in as we talk about it. So first, I'll give some background on infant mortality in Philadelphia. I'll zoom up right here. So in Philadelphia, the infant mortality rate for Black infants is 3 times the infant mortality rate than white infants. The infant mortality rate for every race ethnicity in Philadelphia has remained relatively constant over time from 2010 to 2019. Philadelphia has an infant mortality rate which is 8.1 deaths per 1,000 live births, which is one of the highest compared to other major US cities. And you can see in this chart and below there that Philadelphia, again, its infant mortality rate is much higher than many of the other cities with comparable populations, including Chicago, San Antonio, Houston, Dallas, Phoenix, and more. And you can, again, look more closely at this at the poster that is also part of this presentation. And then below that, you can see a graph that shows our infant mortality rate based off of race in Philadelphia. So you can see for Black infants, it's much higher than our citywide rate, Hispanic, white, and Asian births. So that is some background on infant mortality in Philadelphia. And so the aims of this initiative are to utilize the perinatal periods of risk framework to develop a new infant mortality prevention initiative for Philly and to incorporate community voice and feedback of community members and community-based organizations in this PPOR data analysis process. And so in order to explain that aim, I will explain what the PPOR or perinatal periods of risk is. And so you can see it here under the methods section. What perinatal periods of risk approach is a 6-step method which is recommended by CityMatCH, which brings communities together to elevate community voice and promote data-driven decision-making to reduce infant mortality. And so below this, you can see that there is a 6-step process as mentioned in the definition, and I will mention what those 6 steps are. And so the first step is to assure community and analytical readiness. The second phase is to conduct analytic phases, both quantitative and qualitative. The third phase is to develop strategic actions for targeted prevention. The fourth is to strengthen existing and or launch new prevention initiatives. The fifth is to monitor and evaluate approach. And then the 6th phase is to sustain stakeholder investments and political will. And so we're utilizing this approach right now. And for this poster, we are talking about phase 1 and phase 2, although we are now in the 3rd and 4th phase of this process. And so as mentioned, Philadelphia, we used a mixed methods approach to understand the rates of infant mortality and the risk factors associated with infant mortality. And community engagement was integrated in all steps of the PPR analysis. And so now I'm going to talk about phase 1 and phase 2, which is the focus of this poster and what we have done for our methods. So to begin, fetal and infant death were first mapped into 4 periods of risk. The target population that was chosen was Black non-Hispanic fetal infant death. The Community Action Network next utilized our community group, which is made up of moms and birthing people in Philadelphia who live in the zip code with the highest infant mortality rates and who are a mother or a birthing person or are pregnant. And so this group of people, they worked with our CAN steering committee, which is a group of the co-chairs of our work groups, as well as backbone of our project. They came together and they chose a reference group for this analysis, and they chose white non-Hispanic fetal infant deaths as a comparison with the target population. Next, the results of this phase 1 analysis were presented to the CAN community group and the steering committee, and they selected maternal health prematurity as the risk area to focus on. As you can see here, this little chart shows the different periods of risk. Then please. Okay. So next was phase 2. So again, we utilized a mixed methods approach to understand the risk factors for maternal health prematurity, since that was the period that was selected. And we then created a list of risk factors, which were shared with the community group to expand and prioritize. So not only did we, share those risk factors which were associated, but we allowed the group to share any other indicators they thought should be part of this period. Then a logistic regression of the factors from the final list was performed to determine which factors were associated with very low birth weight in Philadelphia. Next was our qualitative analysis, and what we did for that is use semi-structured interviews to understand the experiences of Philadelphia residents from our target population. And participants for this were recruited through snowballing, sampling, and social media posts. Interviews were transcribed, and a thematic analysis was used to identify significant experiences in the pre-pregnancy and pregnancy periods. So that is the methods we used. And so now I'm going to talk about the, I'm just going to move this over so you can see the results. So as mentioned, the fetal infant mortality rate for Philly is 8.16 per 1,000 births. And this chart here shows the target population and the reference population. The reference population, which was chosen by our CAN community group and steering committee. And so the rate for target population was 10.61 per 1,000 births. And the reference for the reference population, and which was white non-Hispanic, was 4.72 per 1,000 births. So this chart shows the overall difference, as well as the difference for the maternal health and prematurity risk period, which was chosen by our CAN community group and steering committee. Further down, you can see that the rate of preventable fetal infant death was 5.89 per 1,000 births, with the maternal health prematurity period making up the largest proportion of preventable death, which is 54.3%. So this little pie chart here shows, again, the maternal health prematurity has the highest amount of preventable deaths here. For our qualitative interviews, our results were that we had 36 interviews conducted and an analysis to process an analysis and process. And the preliminary themes we found have included supporting mental health, strengthening social support systems, and improving access to quality prenatal care. And here is just one quote from one of the interviews, just to share some of our preliminary findings. And this quote says, "I was in labor for 3 days. I was sent home twice from the hospital. I was told repeatedly, you're not in enough pain. I was told, come back when you're in more pain. Come back when you're more dilated." So that is our poster. And again, since we have submitted this abstract, we are now in our phase 3, where we've taken these results and have begun figuring out what kind of targeted interventions we'd like to have our work groups focus on. And also, and I forgot to mention, the conclusion of this at the very bottom. Let me zoom back in. My apologies. Hold on. You can see at the bottom, our conclusion was that engaging the community at different stages of analysis helped to determine an appropriate reference group, prioritize a period of risk, and expand the risk factors to review. A mixed method approach is necessary to inform action and center community priorities. And so that is the conclusion of this work. And this image here at the bottom shows many of our community group members who were key in this process. And again, I mentioned before that we are now in the process of using this result to figure out our targeted interventions. And as we work on this, if you are interested and want to be updated on the work we're doing, you can again visit phillycan.com or feel free to email me My email is in my profile, but it is sammantha.shuster@phila.gov. Thank you so much.